Hello and welcome to your Nursing Rule audio lecture. The topics listed here are all very important components of requirements within the practice nursing and the nursing role. Let's start by looking at professionalism. The four components that are addressed on this slide are actually similar, if not identical, to those you have applied in nursing. The article included in your assigned reading is a nursing research study that looked at the benefits and results of collaboration between nurses and collaboration among the disciplines. The name of the article was The Impact of Professionalism in Nursing on Hospital Bedside Monitoring Practice, which is located in Canvas. It begins with the premise that the observations and actions by nurses and physicians often determine patient outcomes. Does your patient improve, or are there unintended admissions to critical care, or episodes of cardiac arrest, or even death as a result of nursing and/or physician actions? Results will show that nurses are often the ones responsible for detecting signs and symptoms of deterioration. This occurs most often as a result of intuition judgments that you have as a nurse and how well you have been able to recognize certain health patterns. When we talk about how we regularly or consistently conduct our practice at the bedside, we must understand that the habits we develop determine our level or quality of professionalism. In this particular study, the authors found that professionalism includes the following: personal involvement in clinical practice, so both as an ongoing assessment and a reflective assessment, and professionalism includes knowledge, skills, and clinical experience. Looking at a practical application that was described in this study was the following. The researchers found that nursing did not monitor a complete set of vitals 3 times a day, which included blood pressure, pulse, respirations, and temp. But as clinical experience increased and age increased, the recognition and practice of thorough monitoring practices did increase. Another interesting note was that respiratory rate was monitored the least and also asked for by physicians less than other parameters. Why do you care about this? Respiratory alkalosis, DKA, heart failure, pulmonary embolism, sepsis, pneumonia, anxiety. So even if the physician does not ask about respiratory rate, you should always have that component as part of your assessment practice. The American Nurses Association states that nurses must always comply with and adhere to state nurse practice acts, regulations, standards of care, and ANA Code of Ethics for nurses with interpretive statements. There are 9 propositions that the ANA addresses. The propositions in this code classify nursing responsibilities. The interpretive statements offer direction for you to apply these duties. All of these provisions and interpretive statements are described around a case study of 2 nurses named Keisha and Kyle. They are located in Canvas, titled Code of Ethics Part 1, which includes provisions 1 through 4, and Code of Ethics Part 2, which includes provisions 5 through 9. As you read through these 2 articles, you may be able to find the application of each when applied to the specific scenario described with these 2 RNs. This provision discusses ethical obligations, such as confidentiality and the development of trust. This trust can be between the nurse and the patient, or the nurse and family. Nurses need to provide support for family and provide both patient and family comprehensive and accurate information to make it understandable for them. Understand that confidentiality can be the key element to the development of a trusting relationship. As a nurse, you must provide each patient and/or family the opportunity to participate in their care. So an example of that is when, as nurses, we do handoff or bedside report at the bedside to include the patient and family. You must be able to constantly own your own personal values from that of the patients, support group, and providers. When you address the need to institute collaborative efforts, you may be starting a conversation with the physician regarding patient lack of understanding or differing opinions. The professional boundaries listed here is related to the nurse-patient versus nurse-colleague relationships. The principle within this provision is the obligation as the nurse is to protect all of your patients from harm. So for an example, as the RN, I am the patient's advocate. And if a patient's wish is to be a DNR and the provider disregards their wishes and refuses to write an order in accordance with their patient's wishes, it is my job as the nurse to be their advocate. Responsibilities and obligations of this profession include responsibility for quality of care. This addresses all of your actions, your decisions, and your judgments. An area here that we will look at in a bit is the importance of making appropriate assignments and delegating within the scope of practice. As a nurse, you are responsible for maintaining your overall well-being. Remember, if you are not okay, it will be very difficult for you to care for others. You may find yourself in situations that you will have to refuse decisions or actions that you believe is not in the best interest of your patient. You should stay up to date in the profession, such as attending conferences, obtaining certifications, journals, or organizations. Provision 6 states that you are accountable for establishing, maintaining, and promoting an ethical work environment. This includes all staff, managers, and nurse executives. This statement addresses the requirement for the following: nursing knowledge development, constantly upgrading practice standards, and the requirement to lead or serve beyond the immediate practice environment, such as the local, state, and/or national groups and policy-making organizations. This provision addresses health as a universal right of individuals. We must collaborate with other disciplines in order to effectively address human rights and health inequalities. This final provision calls for nursing organizations to provide a united voice for the entire profession. Educational requirements for entrance into entry-level practice, certifications, and advanced practice must be supported. We are the ones responsible for evaluating, advancing, and changing current health policies in the U.S. The ANA also recognizes the need for U.S. nurses to participate in global policies related to care issues, disparities, and access. Listed here are the primary ethical nursing principles that you will find in the nursing literature. These are also a component of your primary care plan in the clinical setting. You as a nurse are held responsible for the care your patients or clients receive. With this in mind, You must exercise prudent judgment when accepting responsibilities, seeking consultation, and delegation of activities to others who provide patient care. You are accountable for the ethical code of conduct and must follow the ethical principles in nursing, which are located here on the slide. You are accountable for your practice, even when there are system or technology failures. Although you are always responsible for your own judgments, decisions, and action, there are circumstances where the institution will also be liable. You have the right and the obligation to accept or reject assignments based on your education, knowledge, competence, and experience. You must continually assess your own level of competence. When the needs of your patient exceed your abilities, you must collaborate and pursue consultations with additional resources. So getting that information from other nurses or healthcare providers. Assignments and delegations must be consistent with state practice acts, organizational policy, and nursing standards of practice. You must always assess the knowledge, skills, and experience of individuals to whom you are assigning tasks. Listed here are the primary ethical nursing principles that you will find in the nursing literature. These are also a component of your primary care plan in the clinical setting. Nurses are challenged to engage fully and partnership with all members of the interprofessional team to guide the change from that of the provider-based, fee-for-service, to that of a patient-centered care paradigm that encompasses completely across the health paradigm. Essentially, this means that we must shift from a disease focus to a health focus. The concept of nursing is that it is the art and science of nursing what we do. The concept of a person is, this is the one receiving our care. This can be the patient, the family, friends, or even an entire community. Health is defined in accordance with the patient's viewpoint. What may be health to one person is not necessarily health to another. It can encompass physical, psychological, intellectual, emotional, and spiritual components. And the environment will include internal, external, and social factors that impact the patient's health. This should give you an idea of the various components of the paradigm that are shifting in healthcare. When you read your article on leadership, see if you can integrate these 5 components as well into the mix. Collaboration. It calls for incorporating interpersonal and organizational skills. You have to be willing to cooperate, be self-confident, be able to think from a systems level. You must be able to participate in conflict resolution and constantly be aware of how you communicate with others. Negotiation is essential for conflict management. For example, as a staff nurse, think about how you would utilize this skill to negotiate with a patient to ambulate after surgery by giving the patient extra time and some analgesia. Positive or excellent communication skills are what allow you to interact and build effective relationships with your patients, families, and colleagues. Coordination involves assigning responsibilities, organizing roles, supervising others, and delegating tasks. When you evaluate, you assess new information. So what is your patient's condition or state of well-being? Is the care you are providing effective? And is the outcome achieved? There are guidelines that need to be considered in formulating objectives. For nursing, they are holistic approach, prescribed standards, and writing a nursing care plan. Delegation has been part of the history of nursing. Part of the training of nursing has emphasized doing things right, such as making beds, personal care, and etc. This training is to allow you to have the knowledge of the task to delegate. For a short period of time in the history of nursing, the nurse carried out all tasks. The all-RN unit is not a feasible part of the future of healthcare. It is considered a misuse of resources to have RNs doing simple repetitive tasks that can be delegated to others. The National Council of State Boards of Nursing defines assignment as performing a fundamental skill on the job, whereas delegation is allowing a person to perform a specific nursing activity, skill, or procedure that is beyond the delegatee's traditional role and not routinely performed. So please keep in mind the person to whom you are delegating must have had the education or training and validation of competence in the role. There are additional criteria for delegation in the assigned article. As an RN, you must assess not only the client, but also the ability of the LPN or Certified Nursing Assistant or Patient Care Tech, PCTs. Plan the activities you will delegate and how you will assure accountability. You will need to supervise the activity. Was the decision that you made to delegate appropriate? For example, when you arrive for your shift, your usual practice is to delegate vitals and AM care to the unlicensed assistant personnel or UAPs. After reviewing the patient data, you notice the blood pressure was unstable on one patient and another is deteriorating. At this point, you would modify your delegation to include that you verify the blood pressure on the unstable patient and that the unlicensed assistive personnel defer AM care on the deteriorating patient. But instruct him or her to ensure oxygen tubing and monitoring equipment is available in the room of your deteriorating patient and to check the chart for the family phone number. You would review this altered plan with the assistants, ensuring that they understand the new tasks. Meanwhile, after attending to your critical patient with the unlicensed assistant personnel to assist in gathering supplies, placing phone calls, and providing simple comfort measures, you will periodically check on other UAPs, reviewing vital signs, assessing their patients, and observing their performance. As your 2 or more critical patients are stabilized, you will review your decisions of the day. To assure both safe and legal delegation, you must do the following. Assure that the tasks you are delegating are within the scope of practice of the LPN or unlicensed assistive personnel. You must make sure that the task is within their job description. This is an institutional consideration / policy. The LPN and UAP must have been trained and verified learning and ability. And as an RN, you are required to consistently supervise and provide feedback to the UAPs and LPNs. In this section, I want for you to consider your nursing role as an advocate. What does that role look like? What does it encompass? What does it allow? Are there boundaries? So think back to earlier content relating to the paradigm shift from provider-based to patient-centered. Provision 2 in the ANA Code of Ethics is this: the nurse's primary commitment is to the patient, whether an individual, family, group, community, or population. And provision 3 is this: the nurse promotes, advocates for, and protects the rights, health, and safety of the patient. One consistent factor mentioned in many articles is that of improving coordination of care. Are we effectively engaging in teamwork and collaboration? Are we effectively improving communication between our patients, families, physicians, interdisciplinary services, and even insurers? And are we timely with the support, education, direction, advice, and referrals that are critical to improving patient outcomes? One critical area of advocacy is in regards to our responsibility to report suspected or actual patient abuse. Opportunities are always present to refine your assessment skills. But what I want you to review in this segment are specific areas of abuse and indicators to which you will need to stay in tune. Physical abuse can occur within the healthcare setting or prior to arrival. During your assessment, if you note any of the items listed, you may want to follow up with the questions like, has anyone ever tried to hurt you? Have you had recent injuries? Are you afraid of anyone? I've mentioned several items related to emotional or psychological abuse on the slide. Has there been a report or evidence of a sudden onset of delirium or depression? Have you overheard staff or family members verbally mistreating your patient? Neglect is likely a form of abuse that occurs over a period of time. And that could occur in the home or long-term care facilities. You should be asking your patient if he or she is alone. That could be an indicator. Or when you ask for help, does anyone show up? And sexual abuse is an area that may likely go unnoticed or unaddressed. So you need to ask your patient if he or she is afraid of anyone. Has anyone touched you or tried to touch you without your permission? The information on this slide are some takeaways from the assigned article. Patient abuse in the healthcare setting, the nurse as patient advocate. Overall, we all have to identify and evaluate our own personal beliefs and values related to patient rights, respect for our patients, our ethical responsibility to advocate for them and protect them. We also have to recognize why we might fail in these areas. Are we concerned about retaliation, being accepted by our colleagues, or being concerned that aggressive support might affect our ability to advance in the profession? Or are we simply unaware of the signs and symptoms around us? I am certain that you have discussed lateral violence in previous blocks, but we're going to touch on it a bit more at this time. First, understand that it's been around for a number of years, maybe forever. Awareness of it may be the reason that it is addressed so frequently, along with the facts mentioned on the slide. Anytime patient outcomes are effective, we have to look at methods to correct. Organizations are always concerned about increasing turnovers, as it is an increased cost to them. Lateral violence can be experienced not only in the healthcare setting, for example, nurse to nurse, nurse to physician, nurse to patient, but also in the academic setting. Newly licensed nurses are frequent targets for this behavior. You may feel intimidated by more experienced practitioners or lack the perceived ability to stand up for yourself. Anytime the work environment is tense and unprofessional, patient safety is at risk. Another outcome is this: you started your career with passion, excitement, and positive expectations. Now you may find that you dread going to work, or maybe are considering changing professions. One of the potential ways to avoid all of this is through education about lateral violence and then active involvement in preventing its occurrence. We can always learn new and effective ways to deal with these situations and improve relationships. Learning better communication techniques is critical. Putting supportive procedures in place to assist new nurses as they transition into practice, such as preceptors, is shown to improve retention and patient outcomes. It is also a responsibility of nursing management to implement programs, promote cultures of safety, and consistently monitor working environments.